numbers are out this morning on Cover Oregon. We've learned the program has already cost taxpayers $200 million.
The website received $305 million in federal money, and in just over 3 years, program officials spent $200 million of it and still don't have a functioning website.
After weeks of asking for a one-on-one interview and being denied, the governor agreed to do it today. K2 has well documented the magnitude of problems with this project launch. His spokesman ended our interview shortly after those questions. We have an email from Representative Patrick Sheehan, went to you, and he encouraged you at the end of 2012 to let her go.
I got into my office, but I didn't see it.
You never actually saw it. Okay.
Hillary, we have time for one more ad.
More mess for the state healthcare exchange.
Yeah, the state is now adding another 70 people to the agency to run the program. It's just another move to fix the problems.
Well, Rod, these new employees are being added to the state exchange's call center, and it will tack on several $1 million more to the cost of getting the exchange to work. Governor O'Malley was at that event too, but he slipped out a side door before we could ask any questions.
Coverage started today for thousands of people who signed up for Covered California, the state's version of Obamacare. But frustration is growing for one local man who's tried for weeks to sign up and still cannot.
Well, the deadline for coverage starting today has already come and gone for Stacy, who says he's now stuck wondering when or if he'll ever be covered.
This whole deal needs to change. It needs to get better.
Growing frustration for Stacy Clark, who has been trying for weeks but still hasn't been able to sign up for health care.
The Affordable Care Act could cost Jefferson City Public Schools more than $150,000.
This came to light at last night's board meeting when district officials told board members they would have to pay health insurance for substitute teachers.
Illinois residents trying to sign up for insurance under the Affordable Care Act are now facing sticker shock over just how much they will have to pay for their coverage. An analysis by Crane's Business shows many of the plans being offered here in the state of Illinois have very high deductibles and copays. According to Crane's, many of the plans don't pay out until consumers meet deductibles of about $8,700 or a little bit more. Not to make matters even worse, those plans only cover 70% of cost once that deductible is reached.
Health insurance marketplace glitch has affected about 18,000 West Virginians trying to sign up for Obamacare. The State Department of Health and Human Resources says that the federal exchange is having problems transferring account information to and from West Virginia's system.
The Hawaii Health Connector has been having problems eerily similar to what happened to the Obamacare website on the mainland. Even people assigned to help others navigate the site are telling us this. Howard Dykes explains.
Good morning, Grace. Long before there was Obamacare, Hawaii had a law requiring broad medical coverage from most employers. With that kind of head start, you might think the Hawaii Health Connector would have fewer problems than most states. But enrollment so far is only about 2,000 individuals and fewer than 300 businesses, and that's after a Christmas week surge.
Oh, there's a big announcement today from Minnesota's troubled healthcare exchange.
MNsure says it is extending the sign-up deadline for thousands of Minnesotans who may have had trouble getting on its website. Today's announcement caps a week of turmoil at MNsure.
MNsure is an agency in turmoil. One director resigned, a new one appointed. The website in a Paul Bunyan-sized PR meltdown.
Little home.